So hello, good morning, Dr. Aggarwal. Thank you for being here and approving to have your interview. Thanks for being participating at the second ILD symposium that has been a great success. And here I am today to ask you, what are the evidences of rituximab in myositis associated with ILD?
Yeah, well, thanks a lot for inviting me for the Congress as well as for this interview. So the evidence on rituximab for myositis-associated ILD is really mostly limited by case series. So we have multiple different case series from various different corners of the world, where in most of these case series, you will see that the rituximab had favorable outcome for myositis-associated ILD. And in most time, when rituximab was given in these case series, you will see that these patients were refractory to previous immune suppressive drugs. So these patients were not doing well on other drugs. And when they were given rituximab, it actually had improved outcomes in terms of improving their lung function, as well as improving their CT scan, and also their oxygenation level. In terms of anything better in terms of the evidence, we don't have a randomized controlled trial of rituximab for myositis-associated ILD. So that's a huge unmet need. We use rituximab quite often for myositis ILD, but we don't have a good randomized controlled trial that can prove its efficacy and safety beyond doubt or beyond case series. So that's the need that we need to do a good trial. Another piece of evidence that comes for rituximab comes from rituximab in myositis or RIM clinical trial, where when we evaluated patients, now this was overall a negative study, but when we looked at who improves with rituximab the best, and the answer to that question is patient with antisynthetase syndrome or antisynthetase antibody has the best outcome of rituximab. And that is why we prefer to use rituximab in patients with antisynthetase syndrome or antisynthetase antibody positive myositis ILD.
Okay, thank you very much, Professor, and have a good day.
Thank you.